This is Dave Sherwin with the Nairobi podcast with Dr. Joy King. Dr. Joy, thank you for coming on the show. Did I
Yes,
say King or
yes,
Kong?
yes, King Kong,
Oh,
we're a
man,
family.
King Kong. I'm so glad you have a great sense of humor. Dr. Joy Kong. And by the way, do people call you Dr. Joy? I mean, that sounds so great. I
Yeah,
hope they do.
I do. I call myself Dr. Joy. I used to tell people, I said, people ask, what should I call you? Should I just call you Dr. Kong or Dr. Joy? I said, when you call me Dr. Kong, it's like you're showing me a sign of respect. But when you Dr. Kong, when you call me Dr. Joy, it's like you're giving me a hug. So I like it both ways.
Yeah.
But, a hug is nice.
Well, I love that, and your resume, man, you've done a lot of work to get where you are. You're not only a medical doctor, but you have triple certifications. Tell us a little bit about that. And let's start with how long exactly were you in medical school?
Well, well, medical school, it's a 4-year curriculum, right? And then after that, you do for psychiatry, you have a 4-year residency in psychiatry, and then after that, I've been working, finished my residency in 2008, so it's been 14 years. But it's a long journey. But I think I feel like as doctors, we don't necessarily know more than somebody who has gone in depth and studied a lot in one subject without the degree. I have a lot of respect for a lot of very smart people, but I happen to have the MD behind my name, so that's kind of how I feel about it.
Well, and we've got a question already online, and so I'll get to that in just a second. It leads us nicely into the topic, but just very quickly before that, for those of you listening, Dr. Joy is a triple board certified physician, the American Board of Psychiatry and Neurology, American Board of Addiction Medicine, and the American Board of Anti-Aging and Regenerative Medicine. And she's the president of Uplift Longevity Center in Los Angeles, which we can see from her background is where she is right now. And she specializes in stem cell theory and ketamine therapy. And we're not going to spend a ton of time on ketamine therapy, but Dr. Joy, the very first question that has come in from Ace is, thanks for the session. Does ketamine therapy help with existential depression / crisis? So let's just jump right into it and spend a few
I
minutes on ketamine.
definitely think it does. Yeah, I think that's one of the piece that has been exciting me so much, because I think the world is in a dark place. I mean, it looks bright, but it's psychologically, I think there's a lot of darkness, partially from our ignorance. If we don't understand why we're here and really who we really are, then it's very easy to get lost. So first of all, you need to know who you are. So I think ketamine experiences can give you a glimpse of who you might be. It might be completely different from what your what your assumptions were, that you are this solid entity in this realm and this is all there is. There's a lot more. There's a lot of things out there. So I think this potentially could be a way to not only help one person's existential crisis, but helping nations, and the entire human species, for our existential crisis and our tendency for violence and war. So I think it's going to open up and elevate our consciousness. Yes. And a lot of people, once they see that, a lot of these anxiety about who they are, what's going on in their lives will dissipate.
Interesting. How would you compare ketamine to psilocybin?
I think they're very, very different. Ketamine is a very pure molecule, right? It's one single molecule, although the mechanism of action is very, very complex. I'm actually going to be speaking at a psychedelic conference just in a few weeks. So, it can be many ways it works. And the same as psilocybin and all the other psychedelics, most psychedelics are plant medicine. So a plant will have multiple compounds and having very complex actions. So psilocybin is, one of the molecules, in the mushroom. But, I think, when people ingest mushroom, there are different strains, there are different, it's not just that molecule, it's what's in that plant that produce a synergistic effect. When it comes to ketamine, it becomes it's more controllable, right? We've got this one simple, elegant molecule that's been used, been FDA approved since the 70s for anesthesia. So we got over 50 years experience with this particular molecule, and we know it's extraordinarily safe, at much, much higher dosage than what we use ketamine therapy, for when it comes to depression. So probably at 5 to 10 times the dosage, that's what doctors use to induce anesthesia. So we know the safety profile is one of the safest anesthetics in the world, even for cardiometabolically, or pulmonary unstable patients. And also is on the list of WHO's the list of essential medications. So it's a extraordinary molecule. So I think it's much easier to study in a sense that it's very precise, and we have very easy way of controlling the dosage. So that's why there has been so much study, and probably one reason why it's approved. So yeah.
Does it create a psychedelic experience as well, or
Yes.
is it a low dose kind of a ongoing treatment? Describe let's start with who is a candidate, who comes to you for ketamine therapy. Give us the top examples of term. When I say who, I don't mean specifically people. I mean the kind of profile of a person that comes to you for ketamine therapy.
Yeah, I would say, of course, it's FDA approved for treatment-resistant depression, so definitely depressed patients, and people with anxiety, with PTSD, with addiction issues, people with chronic pain or chronic migraine. So all these it's very helpful, very helpful for these conditions. OCD. The only people I will be very cautious with will be people who has ongoing psychosis or has a diagnosis of schizophrenia. I probably would not want to do that because, we still don't understand exactly what's going on with schizophrenia. Even though, I'm a psychiatrist, I've, seen a lot of patients. We don't know exactly what's going on in the brain and why, there's these psychotic symptoms, why they're losing touch with reality. So, but one thing, just conceptually, I think this population has trouble kind of holding on to this dimension of reality already. So if you give them something that can potentially have them get out of this realm and experience other kinds of realms or other, different levels experiences, it's very difficult for them to come back. So people who have schizophrenia or people who have had have ongoing psychosis, such as in bipolar disorder, manic episode. So somebody that has ongoing issue with losing touch with reality, but it's not a contraindication if the bipolar disorder patient is properly stabilized for their mood. So that I'm still, okay with using ketamine. But generally, a lot of people are using it for even existential crisis, or having a cancer diagnosis, facing something they've never thought about, which is the end of life, and having severe anxiety, and this has been shown to be extraordinarily powerful to completely knock out the fear of death. And of course, it's for suicidal ideation. It's very powerful. There's nothing that's as powerful as ketamine at taking away people's suicidal thoughts. Within a couple hours, the thoughts can be gone. So it's a very interesting molecule.
Well, and thanks, Ace, for the question. And by the way, Dr. Joy, he says, thanks for the answer. I'm currently questioning everything in life. Why? I have an appointment with a lab here in Connecticut on Thursday. We'll report findings. So Ace, thanks so much for participating, and Dr. Joy for the great answer. Anything else you want to add on ketamine before we jump into stem cell research?
Yeah, I think ketamine, it's also, not just for these conditions. One thing I love about ketamine is neurogenesis. The part, one of the qualities to regenerate neurons and enhance synaptic growth. So in that sense, it's neuroprotective. So that is one reason I'm, incorporating in my clinic. Besides I'm fascinated by the brain, but I think neurological repair is still a challenge, even with stem cells. It can be very helpful, but we need all the tools we can get for a lot of conditions. when it involves wiring up the brain, especially, is going to be very hard. And I'm not going to be able to get somebody well using stem cell therapy for PTSD or, for, other, issues with past trauma, whereas ketamine can get into the brain and bypass the traumatic experience and give you a whole new perspective. And that is something that's, that's exciting for me. So I'm all about, wellness, right? I can't just give somebody a healthy body without them feeling good about living. So that's the, we want to have everything come together.
Well, speaking of which, let's talk about people who, everyone suffers in some way or another, at a certain level or another. We all have difficulties and setbacks, layoffs, loss of relationships. We all suffer in some way to some degree. And so what about for people who aren't diagnosed with a condition? What about just ongoing use? Like, we hear about the, Silicon Valley. They say that everyone is microdosing something right now. And these are people that are generally considered stable and healthy. So what about quote unquote normal, healthy population taking treatments like these?
I think just like people who are trying to take like, ayahuasca, going on journeys like that to gain a deeper understanding of themselves. So there's definitely some people, that's what they are looking for is, first of all, perspective and then clarity. And giving them a sense, I think the previous sense that they didn't have, including, how they feel about themselves, the sense of purpose, and the sense of connection. So there are definitely people who will do periodic, have a journey, let's say, every 1 to 3 months, just to kind of, feel more connected and get a more of a clarity. So some people definitely do it that way. Yeah.
Okay, perfect. And one last point on this before we move on. Have you seen How to Change Your Mind, the series on Netflix
Yes, I
by Michael
have.
Pollan?
Yes.
Yeah,
Yes.
yeah. And did you like that, or do you have a critique of it, or what was your thoughts?
Yeah, I liked it. I think it did not talk about um, was it psilocybin? Did it talk about
Episode
psilocybin?
1 was LSD. Episode 2 is psilocybin.
Okay.
3
I know I
was
missed a few of them. It definitely did not talk about ayahuasca. So yeah, there are a few
peyote was
that
the last one.
yeah.
Oh,
So but
and
definitely
MDMA. MDMA was number 3. So go LSD, psilocybin,
yeah.
MDMA, and peyote. Or
Yeah.
was it peyote?
There's
It was
it's
the one
peyote.
that,
Yeah.
yeah.
There's a lot out there. So yeah, I did like it. And I think, that's just it's a manifestation of the kind of consciousness renaissance that we're experiencing. It's just
Right.
a huge wave. Yeah. And it is pretty exciting. It's like I'm riding on two waves, one wave of consciousness awakening and the other wave, like the human body potential awakening through, the biologics like stem cells and exosomes and peptides. And yeah, so, it's a pretty exciting time to be a doctor. Unless you are a doctor that has blinders on.
And we got to admit there's just too many of those. I mean,
It's sad.
I'm happy to talk to someone like yourself that's at the cutting edge of this. And, it's a fair criticism, not just in the medical field, but, for all of us, we can get stuck in old habits. I mean, the world's moving very, very quickly and not always in good directions, but I feel like in wellness, there's a lot of great things happening.
Yeah.
And people who don't keep up, or people who, God forbid, they're just following the money. I mean, but that's a part of it, right? Like if you're in the pharmaceutical industry right now and you're selling a drug that people are paying $100 a month to manage their prescription, to their depression, sorry. And then you see that one, heroic dose of psilocybin or however ketamine is administered or whatever, or any of these, fill in the blank with the natural solution that could really solve or mostly solve a person's problem. That's scary, right? So there's people out there that are not excited about these natural solutions and this movement in the consciousness arena.
They're not. Yeah. Yeah. But, history always shows what, where the light is at. So we'll leave it at
Okay.
that.
I love it. Let's jump into stem cells. Tell us about your work with stem cells.
Yeah, so about 6 years ago, when I got into just the exciting field of anti-aging medicine, it definitely is a light bulb went on. When people talked about, okay, so aging is a prequel to disease. So if you can halt all the factors that are triggering the aging process, then you can stop the disease potentials. So I thought, oh my God, this is fantastic. So let's work on aging. And then very quickly, stem cell came into the picture because that's, anti-aging field, same as functional medicine, integrative medicine. It's all kind of one giant field. It's the earliest to embrace new technological, breakthroughs and cutting edge research. So stem cells definitely was embraced very early on. And I saw my first impression of stem cells. I was talking with this doctor who used umbilical cord blood stem cells for this kid with autism. And he showed me about 40 things, 40 changes that the child's teacher noticed and sent him, via text, or send it to the caregiver. And then, so he showed me these 40 changes, and it was mind boggling. As a psychiatrist, there was a reason I did not go into child psychiatry, even though I thought that would be really cool. But I realized, okay, I will be dealing with autism all the time. And it seems like the tools we had was just sedation. That's pretty much, okay, we give some stimulant to, still to calm them down. And then we'll give them all these drugs, including antipsychotics. And I just didn't see that these kids were actually healing. They were just hanging on, so they're not causing more troubles. So that was too depressing. And then seeing how stem cell therapy, a simple IV infusion for this little kid, could produce 40 changes that I would never be able to do. Maybe I with all these drugs, I can make, a few dents, the kid will be a little calmer, but the kid is not going to speak more, is not going to be more socially interactive, better eye contact, have, the as far as less procrastination, like all these aspects, so many aspects, I just don't think the current psychiatry is able to produce. So that's what got me very impressed. Just to show you how most doctors had blinders on. Even though I was sort of a forward-thinking doctor, always interested in personal health and always trying to optimize things, but I had no idea that stem cell therapy was even going on. I thought it was still in research. So when the doctor told me that he was doing stem cell therapy, my question was, what? They're actually using it? They're giving it to people? I mean, that's where most doctors are at. You have to realize, when you finish medical school, they don't talk much about stem cells in medical school. I don't know how much they do now. I think maybe a little bit. But you go out and then you go on your continue medical education, and it's all pretty much drugs, right? When you go to conferences sponsored by the drug companies, so you are kept in this cocoon. And so most doctors, I laugh, when people say, my doctor said there's no evidence of stem cell therapy yet. I said, well, okay, what kind of evidence would he like? I have so much evidence I can share. So, if you don't look for it, then you're never going to find it. That's because their world is embraced. It's sheltered by the drug paradigm.
Do you know, I have found that when someone says there is no research about or of fill in the blank, that is a person who has their own agenda and is generally uninformed.
Yes.
And I run into this all the time. We own a supplement company, right? Our company is Nairobi.com. We do this podcast to help people understand how to live a healthier life, and supplements, nutrition, fitness, those things all go together. And every now and then someone will say to me, well, my doctor said I don't need to take any supplements. What do you say to that? And I say, send me their nutritional blood panel. That's all I need to know. And what do you mean? I said, well, if they're so sure about that, have them have a nutritional blood panel and show you that they're not deficient in vitamin D, in calcium, in chromium, in, fill in the blank. Just show me that they have no deficiencies and I will believe them. That's all I need.
Right.
It's a very simple test, and it's a personal test. You can back up your own beliefs about nutrition and fitness through testing yourself, right? Now, in the medical world, I know that's kind of a snarky answer, but to just test yourself. But the fact is, there is research on almost everything. What area on this planet has not been researched, right? As a matter of fact, there's so much research on so many topics that oftentimes a person can just find a study that matches what they already believed. And that's typically what they do, right? We're not scientific creatures. We're storytelling creatures who adopt beliefs and then want to stick to our beliefs and not have them overturned.
Yeah. It's
That's
actually
my
very
life experience.
interesting. I was just listening to a podcast and someone was saying that, we say it takes on average about 17 years for the most cutting edge research to percolate down into medical practice. But the
Wow.
truth is it's about 100 years. So, especially for therapeutics, not for surgery, because surgeries actually is a very kind of collective endeavor, because one surgeon said, hey, I cut it this way, I did it sewed it up this way, I this is my route, and then everyone's like, okay, that gets better results. They're not under the same governance at the FDA.
Okay.
So this is a group, like let's figure out what's the best way. So they are always keeping up. But when it comes to therapeutics, drugs, that is, it takes a very, very long time, this whole process. Yeah.
Okay, now speaking of that, and a little bit of controversy around stem cells. So one of the reasons people don't want to talk about stem cells is because it's conflated with abortion, right? And people worry about where are these stem cells coming from? What are we doing to produce these stem cells? And I'd like to have you just talk on that for a second, because it will be a concern on some people's mind that we'd need to talk about before they'd even consider it.
And it's actually shocking that particular narrative is still around, right? It just shows, it's mind-boggling, right? There are all kinds of things that's still alive on the internet. But so in the US, it's not legal to do fetal stem cells. So when you have an abortion and you take stem cells out of the fetus, that's fetal stem cells, and that's not legal in the United States. So I don't know anybody that's doing that, and if they are, something will happen to them. So that's one thing. There are countries that allow that, such as Ukraine. I don't know what's going on now, but they do. They actually, it's not a pretty picture, because I know someone that actually went to the clinic, a big clinic in Ukraine. The way they're getting the fetus is through abortion clinics in Russia, and these women basically sell their fetuses. So they will purposely get pregnant, and then they get a fetus, and then they make some money off it. Wow. And then these little fetuses were, sent to Ukraine, the clinic, and they just grind them up pretty much in a blender. I mean, it's really, yeah, it's, so there are things going on like that in the world, but not in the United States.
Okay.
And also,
so what's going on here? Oh, sorry.
A lot of people also confuse embryonic stem cells with, umbilical cord stem cells. So embryonic is the embryo that, that's the origin, right? The little, little bitty of us, that was the start. That is not allowed in clinical research. I mean, as far as giving it to people, you can conduct some, you can do research, but you cannot give it as a therapy. So that's not allowed. But there's some research going on. So anybody, I don't know anybody that's getting embryonic stem cells in this country. Again, in other countries, you can. So in this country, there are three major forms of stem cell therapy. Two are from a person's own body. So one is fat-derived stem cell, one is bone marrow-derived stem cells, and the other one is birth tissue-derived stem cells. So birth tissue, that includes, the whole umbilical cord, amniotic membrane, amniotic fluid, placental tissue. So that's, these are the three major camps. The bone marrow camp is the oldest, because that's where they first found that there were actually stem cells, and the orthopedic surgeons started using that bone marrow, realizing putting a little bit of bone marrow, on the surgical site actually promoted bone healing. And so they started using that. So that was the earliest. That doesn't make it the best. So the fat-derived stem cells came on second. So fat-derived stem cells has a lot more mesenchymal stem cells. So now a lot of people know about mesenchymal stem cells. It's kind of the gold standard of, what people are trying to get, because these are medicinal you can call them medicinal signaling cells, which is what Dr. Kaplan proposed them to be called. He discovered mesenchymal stem cells because these cells produce these medicinal kind of signaling properties to prepare the body and trigger the body to go into healing mode and to be in a correct environment for healing to happen. And they are all over your body. They're everywhere. Anywhere you have blood vessels, these cells are huddling around the blood vessels. They're there waiting for signals in the blood and waiting for, and then to check what's going on in the environment. So they're really the kind of the, I don't, at best, word is master of regeneration, that they're just these little, soldiers. That's all they do. So these cells actually they're very, very few in the bone marrow. Unfortunately, when you were younger, you had a lot more, but as you get older,
Right.
your bone marrow turns from bright red to yellow. Apparently the liver changes from red to
Mine
yellow.
is still bright red. I'm sure of it.
I know, right? That would be interesting. It should be biopsy to check the legitimacy of your supplements. And,
Yeah.
so in bone marrow, they're very, very few. About 0.1 to 0.01% of the number of cells are actually MSCs, and same for umbilical cord blood, which is why I never used just umbilical cord blood cells for therapy, because you have very, very few mesenchymal stem cells, even though they talk about MSCs in their literature, in these companies' literature. But if you're using cord blood, just know that you're getting very, very few MSCs. But the fat-derived stem cells have a lot. Because you're actually getting the cells, when you trying to separate the cells from the fat tissue, you're actually getting all these cells that are along the blood vessels that are supplying the fat cells. So you're getting the cells that way. It has nothing to do with fat, but you're really extracting from the blood vessels. And the birth tissue derived stem cells, the umbilical cord tissue, is full of MSCs, just, especially right around the vasculature, around the artery and arteries and vein. So it's very, very rich in MSCs. So, I'm a proponent of using cells that has a comprehensive profile. So, I like the benefits that can be obtained from umbilical cord blood, but I also love the fact MSCs are so potent at promoting this whole regenerative possibilities. So putting them together. So that's kind of the quick overview.
Okay.
People need to understand, if you're using your own, if you're less than, I would say, 45, or so, probably is fine. But just imagine if you're 40 years old, your cells are not nearly as potent as a 0-day-old birth tissue. But first of all, the baby may be 0-day old. The birth tissue actually is younger. It's like minus 90 days or something, because they realize that when the baby was forming, a lot of cells were trapped in this, placenta and umbilical cord. So they are the early cells while the baby was forming, and they retained a lot of characteristics that were only present in embryonic stem cells. So they're kind of like halfway between the embryonic stem cells and the baby's stem cell. The baby is fully developed. That's considered an adult stem cell source. So the birth tissue is in between. It has the potency of embryonic stem cell, a lot of the potency, but doesn't have the crazy potential to form teratoma, the crazy growth of tumor. So it's kind of the best of both worlds. That's why I'm so excited about it. And I'm not the only one. All around the world, scientists are very excited about it.
And so what are you doing with these stem cells? Who is coming to you and for what purpose?
Oh gosh, everybody. I would say if you have, first of all, I'll give you a general category. So people with, of course, a lot of musculoskeletal injuries, knee, back, shoulder, and just sports injuries, and people with autoimmune conditions. There's a ton of research on stem cells benefits for autoimmune diseases. So there are over 100 of those autoimmune conditions, and there's been some really, really solid research around that. But I I don't know if you know, I established American Academy of Integrated Cell Therapy. So I actually teach a stem cell course, and we have evidence of, the categories of illnesses and in different organ systems. I have over 30 categories of, just different types. And within each category, I say, the liver, there are many, many pathologies, right? Different types of pathologies. And within each, there are various articles and various clinical studies that have been done. So, so people then people are desperate. First of all, the traditional medicine treatments have not been stellar when it comes to chronic illnesses. It's stellar in acute care, but it's pathetic actually in chronic diseases. So people are desperate, and people are not getting better. They may be taking medication, they're just kind of hanging on. The quality of life is not good. So people who come to me, some of the conditions like COPD, liver conditions, kidney failure, heart diseases, people who had stroke, who had neurodegenerative conditions like Parkinson's, Alzheimer's, MS, which is kind of autoimmune disease, and people with, all kinds of even, other types of, organ system. It almost like just about every organ, when there's an issue, I can find some support, in literature.
Wow.
Someone has studied. So
lungs.
Yeah, lungs, great evidence, and I've had such great results. I actually love treating lung conditions, because when you do put the cells into a vein, the first place that they go back to, of course, is the lung, but the lung pumps everything. It's the heart. The heart pumps everything to the lungs. And then if you have a lung pathology, the cells are going to be attracted to the inflammation, and they're going to start working right away. So I have such drastic improvements seeing patients, including, getting off oxygen, getting off pretty much all the medications. It just, imagine you're giving a person their life back. So
It's
that's
that
really
good. It's that good. It's
it-
life changing.
it's really fun. Yeah, like had a patient, he was dragging around with his oxygen tank, and then after the treatment, I think we did one, or at the time I was doing 2 sessions. But after that, he got off oxygen. He went, singing with his old band buddies, started playing in a band. I
Wow.
gave his life back. So it's so satisfying. This is why we became doctors, right? We want to make a difference. And
Right.
so many doctors are stuck in a rut, and but there's a light right over here.
So for people listening, if they've got chronic pain from muscular, from a joint, an old injury, whatever, they're a candidate. People with deteriorating organs, you've mentioned, and I assume, do we consider the brain an organ? And what
Yeah.
does it do for mental health?
The mental health, I think that you can calm the neuroinflammation. The evidence is not very, there's not a whole lot of research done on things like
Okay.
depression, bipolar disorder. I think I think it's more complex. This is why
Okay.
I think some of them, especially mental illness, there's wiring issues. But inflammation has a lot to do with it. So stem
Okay.
cells can definitely help with that, but sometimes our kind of erroneous adaptive patterns or just our brain circuitry set up, and that it's difficult for stem cells to address. That's why I think ketamine therapy can be so powerful.
I was just going to say, it's starting to become clear to me why you do ketamine and stem cells. That
That's
makes
right.
sense.
That's right. I really want to help. I want people to be happy. So I can't just fix their body and then, and in their mind, they're either, you know, you know, isolated in the way they're thinking, about themselves and disconnected. And so when you have disconnection, then that's a great way to have unhappiness,
Mhm.
disconnected from yourself and from other people that you should really care about, because we're all here kind of in this one giant journey. Yeah.
Yeah, and in the past, we hear of famous athletes headed overseas, I think Kobe Bryant went to Japan for some stem cell work, and other people have left the country. Now, this is obviously a thing of the past as well. But some people think of stem cell therapy as something you have to leave the country for. Tell us what has happened in that arena and what's going on here in the United States.
Yeah, and which, by the way, is never the case. So that's what's funny about it, and that's another
Huh.
myth that has been persisting. So stem cell therapy, at first, there's no regulation, right? We just discovered, oh my God, there's some really powerful cells, and then if I put these cells into a human's body, which is kind of tissue transplantation, right? As doctors, we are allowed to do tissue transplantation. I can, I can perform surgery and put one organ from one person to another person. That's not part of the FDA, regulation. Of course, yet the labs has to produce, a sterile, clean product. That there's this whole set of regulation underneath that, but it's fine. This is part of medical practice, and same as giving blood transfusions. So at first it was just kind of like, okay, so from one person to another, there's no regulation. And then the FDA decided that they wanted to provide some guidelines, they because things were happening fast. So that's when they said, okay. So if you do not manipulate the cells, and you don't use enzymes, you don't use chemicals, and you don't grow the cells to huge numbers, which can change the cells, then you're performing tissue transplantation. So if what the tissue were doing before you put, in the donor's body, and after you take it out and put in the recipient's body, and they're still doing similar things, that's considered tissue transplant. So that's not a drug. Then you don't need a drug study, and you don't need the FDA approval. So you can go ahead and keep using it. And that's what's been going on all this time. And doctors are operating under that. Some doctors are expanding cells, and some are getting into trouble. And of course, most of the people who are overseas, and I would say probably all of them, one reason they left, it was because they're able to expand and grow the cells to huge numbers. And once you do that, then you have to do a clinical study, which is very lengthy and costly process. So they don't want to do that. So they set up shop in these overseas locations. I have no problem with that, except that the current state of how they're doing it, I'm really not sure if that's doing, that's the best thing for patients, because, there's been research showing how when you start expanding the cells, even at 10 times the number of cells, you're actually losing potency. So you think that, if I give, 100,000 cells, it's going to be better than giving 10,000 cells. And it turns out the benefit is actually less than what you get from 10,000 cells. So just by expanding, by giving people a huge number, which sounds wonderful, I'm giving you 200 million cells. It sounds very impressive, but you're actually decreasing the quality of it. So you likely are producing a benefit that's less than 20 million cells, which is, around the range of what I'm doing, but actually achieving a higher, a greater benefit. So I think people are not realizing that, because when the cells are dividing, they don't just divide evenly into two stem cells. They often divide into a stem cell and a daughter cell. And, study have shown even just 24 hours of expansion, the cells have already lost some abilities to home into, areas of where they're needed, right? Homing mechanism and their differentiation abilities. So it's not that you can just print the money on trees. That's kind of like what I see. You think that it doesn't, it just you can just freely do it. Maybe at one point we can, but it doesn't seem like that's the case right now. So I think I think a lot of people can get incredible results staying in the U.S. and probably cost them half as much.
Well, and if they're going to, they ought to have it done by Dr. Joy, right? Because compared to like a Dr. Smith or a Dr. Jones, there's just no cachet there. Like, how do they come see Dr. Joy? How do they connect with you?
Oh, so my clinic, like you see in the back, Uplift Longevity Center. So you can just look online, upliftcenter.com. And then just send us an inquiry, I'd be happy to go over, how I can help them. We have a lot of tools, ozone therapy, peptides,
Oh,
exosomes,
wow.
a lot of things, and then I look at a person's comprehensive labs. I want to make sure I'm optimizing their hormones and, their blood sugar metabolism, etc. So I want to, really help their body heal. And there should be as many tools as I can get, right? The analogy is, you don't just, when you try to grow a plant, you don't one day give it sunlight, the other day give it soil, and the next day give it water. The human body is kind of like
Right.
that. We are a very complex whole. So you want to add a lot of things so everything can work synergistically. I actually have a lot of helpful videos on YouTube under Joy
Okay.
Kong MD. So that's JoyKongMD. So just look on there. I have a lot of videos. I explained different kind of nitty gritties about stem cell therapy that no one was talking about, such as
Okay.
having other people's DNA in your body. What does that mean? What is there a
Right.
problem there? And what about the 3 stages of healing in stem cell therapy? So there are different stages, what you can expect, after you get the treatment. And then, I talked about Panama, in more detail, just about what's going on, what's the difference, and what's the difference between stem cells and exosomes. So I think people will find it pretty interesting and helpful.
Okay. So a Joy Kong MD YouTube channel, and your website is?
Upliftcenter.com, uplift with a Y.
Okay. Well,
Yeah.
Dr. Joy, it's been a pleasure. We could go on forever, but it
I
would turn
know.
into like a biology class and we'd all like not be able to understand you anymore because there's just too much. But for people with chronic pain and people with conditions that are just having trouble getting treated, you could be a great solution, right? Right.
Yeah, I
So
would love to help them. Yeah, I just think so much of the suffering nowadays is not necessary. We have the tools, and that's what's painful for me to watch. I have the tools. So
well, I love it. And thanks for taking the time to come on the show. It's been super interesting to talk to you.
oh, you're welcome. I'm so glad I can share this knowledge with more people. I'm sure it's going to help somebody.
Yeah, I'm sure it is. It's an emerging arena and you're at the front of it. So congrats to you. It sounds like you're doing a great job and got a clinic going that's really helping people.
Yeah, thank you. And I also started a stem cell company actually called Chopra Biologics. So we actually produce the most comprehensive stem cell product that we do send to doctors all over the country. And I also developed a
Wow.
skin cream called Chopra Omni. It's a stem cell skin cream, and that's pretty exciting. So yeah, I'm into a lot of things.
You're a triple certified doctor and an entrepreneur and a wellness expert. I mean, you
Oh,
got a
thank
lot of
you.
hats.
Thank you.
Well,
All I can think of is just keep learning and keep driving forward and see what kind of difference I can make.
I love it. Thanks again.
Thank you so much.
For those of you listening, this is Dave Sherwin wishing you health and success.